We are your vaccine authority, and the CDC's vaccine committee is getting ready to meet this week to discuss expanding access to Pfizer's booster shot for all adults. It comes as the company is also seeking emergency use authorization for an experimental pill used to treat COVID. Channel 3 Eyewitness News reporter Matthew Campbell spoke this afternoon with a doctor to figure out what this could mean for you.
Joining me now to talk about what this could mean for all of us is Dr. Om Deshpande. Doctor, thank you very much for joining us. And federal regulators, they're set to meet this week to discuss giving COVID boosters to all adults. Now, how big will this be in preventing winter surges?
You know, it's a great question. I think it will have some impact. I don't know that it's going to be the end all be all. And just to clarify, what they're talking about this week is really just about the Pfizer booster for all adults. They have not yet approved the Moderna booster for all adults. I expect that, you know, if Pfizer is requesting it, I expect the Moderna will, and I expect that approval to happen as well. I think that the best way, honestly, to prevent a winter surge is to continue to focus on vaccinating people who are not vaccinated. So that, of course, includes kids who are 5 to 11, but it also includes those adults who continue not to be vaccinated. I think that the boosters for all will have a little bit of a positive impact. And, you know, for people who are on the younger side and may not have fit into the criteria that were already approved for, and maybe they're immunocompromised and they didn't know it, things of that nature, it may help a little bit. It's not going to be the main impact in really reducing the risk of further spread.
Now, even, before this approval, we're seeing people, at least here in Connecticut, who are under 65, just go ahead, sign up and get it. Is that something that you would encourage right now at this point? Like, anybody who wants it, go out, get it.
No, I really wouldn't. I mean, I think that it's important. You know, we have healthcare regulators for a reason. There are a lot of experts who are looking at the data, and I think we should follow what's going on. And here at Yale New Haven Health, we are certainly following the recommendations for CDC. I think, again, people do what you just described for a variety of reasons, and they obviously want to protect themselves. I am not sure that the science necessarily supports that level of concern for people who aren't currently eligible. So if there was a reason for, if there was a clear risk and a clear, huge benefit for everyone to get it, then that's one thing. I think that the boosters are incremental in conferring protection. The main thing really does need to be focused on vaccinating people who are not vaccinated.
Got it. Now, what could Pfizer's experimental COVID pill mean for COVID treatment in the future?
I think that, that the medication that you just described is currently, they've requested emergency use authorization. It really does have the potential to significantly reduce the risk of hospitalization and death for people who have symptoms of COVID. So I think that in a lot of ways, it's really important for us not only to have vaccines to prevent things, although they're obviously the best, but there are still people who are either unvaccinated or have breakthrough infections who get sick. And for those people, these antivirals are going to be very important indeed. And I think the other thing that's really important is that they're oral, they're pills, as you just said. The only antiviral treatment, or the only treatment that we've had for COVID before this medication and the other one that's made by Merck, has been a monoclonal antibody, which you have to go get. You have to go to an infusion center. You have to sit down for some time. You have to get it infused in. It's not easy to access, whereas a pill is obviously a lot easier. You get a prescription, you take the pill, you do a lot easier. So it's just so much easier for people to get it, and it will be much more widely available than the monoclonal antibodies. So in a lot of ways, that those antivirals are very, very encouraging and actually quite exciting.
And a reminder, if you need help getting yourself vaccinated, we do have a list of places and resources on the Channel 3 app.